The last application we have is NurseTabs Fundamentals. NurseTabs Fundamentals is the most recent app I developed in response to nursing students wanting simple information as they begin their nursing program. Obviously, the first two apps, NurseTabs Med-Surg and NurseTabs Pharmacology, preceded NurseTabs Fundamentals, but in no way should it be purchased in those orders. As we know, NurseTabs Fundamentals would be first in the sequence for nursing students. As you can see here by the screen layout, NurseTabs Fundamentals is laid out similar to the other NurseTabs applications. We do have some simple body systems, but also we have general considerations like nutrition and safety, which is a key component of teaching nursing students, vital signs, which actually has to do with basic skills that nursing students obtain in the fundamentals courses. We also have a tab here for documentation. It is important that we document effectively for our clients in the care setting, and this gives simple tools to utilize to document appropriately. It also has assessments, so basic assessments related to a shift assessment, head-to-toe assessment, and related to body system assessment. Certainly, if we click on any of these tabs, you will find a variety of options available to you. In the Assessments tab, you can look at a basic cardiac assessment. It not only identifies what to do for the cardiac assessment, but it also identifies what would be needed to carry out a cardiac assessment. If I go into the actual tab All, we get all the equipment and supplies and then the procedure. One of the biggest things that we need to teach in fundamentals of nursing is that students always perform hand hygiene when walking to a client's room and always introduce themselves to the patient, verify the identity of the patient, and explain the procedure to the patient so that we have informed consent. So you will notice that all of the skills within fundamentals have the first and second steps encompassing those main objectives. As we go down, we certainly want to make sure that we protect the lumbar and back integrity of our student nurses. And we also want to maintain privacy for the clients. You can continue to scroll down to find how to listen for an S1 and S2, how to count pulse rate, and how to listen for any abnormalities or arrhythmias. If I go back home, we also have a Hygiene tab. Hygiene tab goes into not only bathing a client, but also all of the necessary things that we might have to do for a client who is bedbound and or comatose. We have oral care for the conscious client. We also have caring for dentures and oral care for the unconscious client. In addition, you can see we have nail care and foot care. We also have how to change a bed for a client. NurseTabs Fundamentals is different than the other applications in that we don't have a straight approach for body systems. So anything related to bowel elimination is under the GI tab here. It includes basic bowel diagnostic tests so that a student can see what types of tests there are that their client might be undergoing. It also includes things like colostomy care or enema administration, which are in fact typical skills that we might do. It also has nursing diagnoses such as bowel incontinence, separated like the NurseTabs Med-Surg application. It has general information about bowel incontinence, what we would assess for, complications of bowel incontinence, problem statements or nursing diagnoses related to bowel incontinence, client-centered goals, and of course the interventions starting with our assessments. As we look here at documentation, you can see that there is a variety of things related to documentation. There is the ADPI, which is the nursing process. So it gives a general statement about what we would be doing for assessment, diagnosis, evaluation, implementation, and planning. In addition, we have notes that you might use in the clinical settings, such as a DARE note. A DARE note is data, action, and response, and it indicates how to write a DARE note for our client. Other common notes that we might use include SOAP notes. One of the other things we have in here related to documentation is HIPAA considerations. Why is it important that we maintain confidentiality of our clients' private healthcare information? So you can see that NurseTabs Fundamentals has a lot of different things in it. Even with the safety considerations, there's a variety of things that we consistently need to monitor our settings for that our clients are in. The goal of NurseTabs Fundamentals is to give students quick access to skills, documentation styles, the nursing process, varied fundamental nursing diagnoses, so that they can respond in a clinical setting to their clients' needs with that quick information. Not only that, but NurseTabs Fundamentals was meant to give a basic understanding of the skills and how to incorporate the skills in clinical settings so that students have a way to review before they go in at the client's bedside to perform the skills for the first and or second, third, fourth, and fifth time. NurseTabs Fundamentals application is not meant to replace any textbooks or teaching. It's not meant to replace what goes on in the classroom or the clinical setting. It is meant to give additional material to supplement learning and give another way for students to engage themselves in the learning process.